So what you're seeing here is a combination of an upright patient positioning system that slowly rotates in front of the fixed radiation beam. And we've partnered this patient positioning system with an integrated diagnostic quality CT. So the concept is that the patient comes into the room rather than being laid down on their treatment table. They simply sit themselves down on the positioning system. And the first part of the workflow is really to optimize their posture, something that we often find really quite difficult to do in the supine orientation. So everything that we have above the ground with this positioning system, its real purpose is to optimize the posture based on the anatomy of the patient and based on the specific indication that we're treating. So we are able here to move the height of the seat, so that accounts for people being shorter or taller. Next, we have the seat pan that is able to transform the patient's position from a conventional seated posture, where the seat pan is horizontal, and it tilts down. And as this seat pan tilts, it effectively puts the patient into this semi-standing posture. In this posture, the legs are completely moved out the way of the beam, which allows us to image lower down into the body and also target the radiation to organs like the prostate, for example, without delivering all of the radiation to the thighs. So that's the seat pan and the height of the seat. Next, we move down to two really important elements of this device, the integrated shin rest and heel stop. And this is really the secret sauce when it comes to adequate immobilization of the patient. We're distributing the mass of that patient across multiple touch points. We're supporting the load of the patient across the seat pan, but also across their shins so that they can't slouch forward. And the heel stop that sits behind the feet of the patient stops the feet from sliding back. So we're really immobilizing the patient at every joint, at the heels, at the knees, and then at the hips. And this is the secret sauce, the real key to keeping a patient stable in the upright orientation. Day to day, the internal anatomy of a patient changes. They might have eaten more on a given day, they might have drunk more on a given day. And within radiation therapy, we have to be able to correct for those anatomical changes. So once we've got the patient into their optimum posture, the next step is for us to position that patient relative to the fixed radiation beam. So for that, we use all of the functionality that is in the base section of this device. So the first step is to be able to translate the patient left and right so that we can offset based on, for example, left-sided breast. So here we're able to move the patient all the way over to the left or all the way over to the right. The next thing is for us to be able to move the patient forwards and backwards. So here we're able to slide the entire patient positioning system forwards or backwards to align that tumor to the isocenter. Finally, as the internal anatomy of the patient changes on a daily basis, we have to correct for rotational adjustments. So we can pitch and roll the patient. What's really clever though about this device is that while the physical pivot point lies within the floor, what we're actually interested in is rotation around the radiation isocenter. So we combine rotations with translations to make sure that we're always implementing those pitch and roll corrections with respect to the isocenter.